What inspired you to become a yoga therapist?
Yoga has always been an integral part of my life, but my journey to becoming a yoga therapist was driven by a deep desire to combine my passion for holistic well-being with a compassionate approach to healing. Early in my practice, I experienced firsthand the transformative power of yoga, not just physically, but mentally and emotionally as well. I saw how it helped me manage stress, improve my focus, and foster a sense of inner peace. However, it was when I began working with individuals facing physical challenges, emotional imbalances, or chronic conditions that I truly realized the therapeutic potential of yoga. I encountered people whose lives were significantly improved by tailored yoga practices, whether it was managing pain, recovering from injury, or coping with anxiety and depression. Witnessing their progress inspired me to delve deeper into yoga therapy, where I could use this ancient discipline as a tool to support people in their healing journeys. Furthermore, I was drawn to the idea that yoga therapy offers a holistic perspective on health, integrating mind, body, and spirit. Unlike conventional approaches that may treat symptoms in isolation, yoga therapy empowers individuals to reconnect with their bodies and minds, promoting long-term well-being rather than temporary relief. The opportunity to guide people toward balance and healing, using such a comprehensive and mindful practice, was what ultimately inspired me to become a yoga therapist. Through continuous study and practice, I realized that yoga therapy is a powerful means of creating meaningful change in people's lives, and this continues to motivate me every day.
What is your personal yoga practice like?
My personal yoga practice is a deeply enriching and evolving part of my daily life. It serves as a foundation for both my personal well-being and my work as a yoga therapist. I approach my practice with mindfulness and intention, focusing not only on the physical aspects of yoga but also on the mental, emotional, and spiritual dimensions. Typically, my practice starts in the early morning when the mind is calm, and the environment is quiet. I begin with pranayama, or breath work, which helps center me and prepares my body and mind for the asanas that follow. Breath is central to my practice because it brings awareness and calm, guiding the flow of movement. Following pranayama, I engage in a series of asanas that vary depending on how I feel physically and emotionally that day. Some days, it may be a more dynamic, flowing sequence like vinyasa or ashtanga, where I challenge myself physically. On other days, when I feel the need for grounding and restoration, my practice may shift toward slower, more meditative styles like yin yoga or restorative postures. Meditation is also a vital part of my daily practice. After moving through asanas, I take time to sit in stillness and cultivate mental clarity. Meditation helps me to stay connected with my inner self, foster mindfulness, and maintain emotional balance. It's in this quiet space that I find the greatest sense of grounding and peace. In addition to asanas and meditation, I continuously work on self-study, or svadhyaya, which is a fundamental aspect of yoga philosophy. I reflect on how the teachings of yoga align with my life, and I integrate them into my daily activities and interactions. This personal practice allows me to approach each day with greater awareness and compassion. Ultimately, my personal yoga practice is not rigid but adaptive. It mirrors where I am mentally, emotionally, and physically at any given moment. This flexibility allows me to better serve my clients as a yoga therapist, as it keeps me attuned to the varying needs of the body and mind. It also reminds me of the importance of listening to oneself, which is something I emphasize in my therapeutic work. Through this daily commitment, I maintain a sense of balance, inner peace, and readiness to support others in their own healing journeys.
How do you incorporate your own experiences into your teaching?
Incorporating my own experiences into my teaching is a key element of my approach as a yoga therapist. I believe that personal experience enriches the depth and authenticity of my guidance, allowing me to connect more meaningfully with my clients. My journey with yoga has taught me that true healing and growth happen through self-awareness, patience, and a compassionate understanding of one's body and mind. These lessons deeply influence how I teach and support others. One of the primary ways I incorporate my experiences is by embodying the principle of meeting yourself where you are. Early in my yoga journey, I often pushed myself physically, thinking that progress was about achieving more challenging poses. Over time, I learned the importance of respecting my body's limitations and honoring its needs on any given day. This realization has helped me develop a therapeutic approach that emphasizes mindful listening to the body. I encourage my clients to focus on their unique experiences, rather than striving for perfection, and to embrace yoga as a personal journey rather than a performance. Having dealt with periods of stress and emotional imbalance myself, I've also come to deeply value the mental and emotional aspects of yoga. I incorporate this understanding into my teaching by placing emphasis on breath work, mindfulness, and meditation. These practices were transformative for me, helping me to find balance and inner calm during challenging times, and I aim to share this sense of resilience with my clients. I guide them in using the breath as a tool to manage anxiety, release tension, and create space for emotional healing. My experiences have also taught me that healing is not linear. There are ups and downs, and progress can sometimes be slow. This awareness has shaped my teaching style to be one of patience and non-judgment. I help clients set realistic goals, offering support and encouragement, especially during moments when they may feel stuck or frustrated. I share my own journey with them to illustrate that it's okay to take small steps and that every bit of progress is valuable. Additionally, I continuously draw on my personal practice of self-reflection. Through this, I've learned the importance of tuning into the subtle messages from the body and mind, a concept I teach my clients as part of their healing process. Whether it's through tailored postures, breathing techniques, or meditative practices, I aim to empower them with tools that I've found helpful in my own life. Ultimately, by weaving my own experiences into my teaching, I hope to create a space where clients feel seen, supported, and empowered. It's this blend of personal insight and professional training that allows me to guide others with empathy and understanding.
What certifications or training do you have in yoga therapy?
My journey to becoming a yoga therapist has involved extensive training and certifications, all of which have equipped me with the skills and knowledge to offer safe, effective, and personalized therapeutic support through yoga. I am a certified yoga therapist, having completed a specialized yoga therapy training program accredited by the International Association of Yoga Therapists, IAYT. This certification required in-depth study of anatomy, physiology, psychology, and the therapeutic applications of yoga to address various health conditions. Before pursuing yoga therapy, I completed a 200-hour yoga teacher training, YTT, which gave me a strong foundation in traditional yoga asanas, pranayama, meditation, and yoga philosophy. This foundational certification was essential in helping me understand the broader scope of yoga as a holistic practice. It also allowed me to begin teaching and develop a deeper appreciation for how yoga benefits the mind, body, and spirit. After that, I pursued a 300-hour advanced yoga teacher training, further expanding my knowledge of anatomy, advanced postures, and how to adapt yoga for different populations, including people with physical limitations or chronic conditions. In my yoga therapy training, I took courses specifically focused on the therapeutic aspects of yoga, learning how to adapt yoga practices to meet the needs of individuals dealing with a wide range of health issues, from musculoskeletal disorders to emotional imbalances like anxiety and depression. I received in-depth education on how to create personalized yoga therapy plans that consider each client's unique condition, lifestyle, and goals. This included training in functional anatomy, biomechanics, and pathology, so I can safely modify postures and practices to suit clients with specific medical conditions or limitations. Additionally, I have received training in trauma-sensitive yoga, which is especially useful when working with clients who have experienced emotional or psychological trauma. This training has allowed me to develop a compassionate, non-invasive approach to teaching, where safety and trust are paramount. It has also enhanced my ability to guide individuals through practices that support emotional healing and resilience. Beyond formal certifications, I regularly attend workshops, seminars, and continuing education courses to stay updated with the latest developments in both yoga therapy and related fields such as mental health, somatics, and rehabilitation. Continuous learning is important to me because it ensures that I can offer the best, evidence-based practices to my clients. Overall, my certifications and ongoing education reflect my commitment to providing comprehensive, individualized care. They enable me to confidently work with a diverse range of clients, from those seeking stress relief and mental clarity to individuals facing specific physical or emotional challenges.
How do you assess a client's needs and tailor your sessions accordingly?
Assessing a client's needs and tailoring yoga therapy sessions to suit those needs is a crucial aspect of my practice as a yoga therapist. My approach is grounded in personalized care, as each individual comes with their unique physical, emotional, and mental conditions. To achieve this, I start with a comprehensive intake process, followed by continuous observation and communication throughout the therapy journey. The initial assessment begins with a detailed intake session, where I gather information about the client's health history, lifestyle, specific challenges, and goals. This often includes discussions about their physical health, any chronic conditions or injuries, their emotional well-being, stress levels, sleep patterns, and even their diet and daily habits. I also inquire about their current or previous experiences with yoga or other physical activities. This helps me understand their baseline fitness and flexibility levels, as well as any limitations or areas that need special attention. If necessary, I may ask for input from other healthcare providers they are working with, especially if they are dealing with medical conditions, to ensure my approach is integrated and safe. In addition to verbal communication, I conduct a physical assessment to observe the client's posture, range of motion, and body alignment. This allows me to see how they move, identify any musculoskeletal imbalances, and determine areas of tension or weakness. I also pay attention to their breath patterns, which can reveal a lot about their stress levels and how well they manage physical or emotional tension. Breath work is often a key indicator of how a client's nervous system is functioning, and it gives me insight into whether they might benefit from calming or energizing practices. Based on this comprehensive assessment, I develop a tailored yoga therapy plan that addresses their specific needs. For clients with physical concerns, such as chronic pain or injury, I design sessions that incorporate therapeutic postures, gentle stretching, and strengthening exercises that promote healing without exacerbating the problem. For example, if a client is recovering from a back injury, I would focus on core stabilization, gentle spinal movement, and postures that support proper alignment, avoiding any positions that could cause strain. If a client is dealing with anxiety or emotional imbalances, I might emphasize calming pranayama, breathing exercises, mindfulness techniques, and restorative postures to help regulate their nervous system and promote relaxation. I also ensure that the sessions are adaptive and responsive to the client's progress. I continuously observe how their body and mind respond to the practice, making adjustments as necessary. Each session may evolve based on their feedback and any changes in their condition. For example, a client managing chronic pain might have good days and bad days, so I adapt the practice to meet their current physical and emotional state. If they are experiencing more discomfort than usual, I might reduce the intensity of the session and focus more on breath work and relaxation. Alternatively, if they are feeling stronger, I may introduce more challenging postures or longer holds to build resilience and strength. Additionally, I educate my clients throughout the process, helping them understand why certain postures, breathing techniques, or mindfulness practices are included in their therapy. I believe that empowering clients with knowledge about their bodies and minds helps them engage more deeply in their own healing process. I also provide them with practices they can do on their own outside of sessions, giving them the tools to manage their symptoms or stress independently. In short, by combining thorough assessments, personalized planning, and ongoing adjustments, I ensure that each session is truly customized to support the client's unique path to healing and well-being. This individualized approach allows me to address not just their symptoms, but the underlying patterns contributing to their discomfort or imbalance, fostering long-term health and wellness.
What is your philosophy of yoga, and how do you incorporate it into your teaching?
My philosophy of yoga is deeply rooted in the belief that yoga is a holistic practice that goes far beyond physical postures. It is a profound journey toward self-awareness, balance, and healing, one that integrates the mind, body, and spirit. I view yoga not just as a form of exercise, but as a way of life, with the potential to transform how we relate to ourselves, others, and the world around us. This philosophy is grounded in the traditional teachings of yoga, which emphasize unity, the meaning of yoga itself, inner peace, and the pursuit of self-realization. One of the core principles of my philosophy is the idea that yoga should meet the individual where they are, both physically and mentally. Yoga is accessible to everyone, regardless of age, physical ability, or life situation. I firmly believe that the purpose of yoga is not to achieve perfect postures but to cultivate awareness, compassion, and acceptance of oneself. This is something I integrate into my teaching by emphasizing mindfulness and encouraging my clients to listen to their bodies and respect their limitations. Whether someone is dealing with chronic pain, stress, or simply trying to live more mindfully, I adapt my teaching to support their unique path. A central concept I incorporate into my teaching is the balance between sthira and sukha, or steadiness and ease. This principle is derived from Patanjali's Yoga Sutras and serves as a reminder that, in both life and yoga practice, we must find a harmonious balance between effort and relaxation, strength and softness. In my sessions, I guide clients to cultivate both stability in the body and mind through strength-building asanas, while also fostering a sense of ease and openness through gentle movements and breathwork. This balance is essential for healing, resilience, and well-being. Breath is another key element of my philosophy. Pranayama, or breath control, is more than just a way to enhance physical practice, it is a bridge between the body and mind, and a powerful tool for emotional regulation and mental clarity. In my teaching, I incorporate various breathing techniques to help clients manage stress, anxiety, and physical discomfort. By learning to breathe mindfully, they can better navigate the challenges they face off the mat, using breath as a way to calm the nervous system, focus the mind, and ground themselves in the present moment. Additionally, I embrace the philosophy of yoga as self-study, or svadhyaya, which is one of the niyamas, observances, outlined in the Yoga Sutras. This principle encourages self-reflection and continuous personal growth. In my teaching, I encourage clients to use their practice as a mirror for self-exploration. Each session is an opportunity to observe their thoughts, emotions, and reactions without judgment, and to become more aware of the patterns that shape their lives. By fostering this self-awareness, yoga becomes not only a physical practice but a tool for personal transformation and healing on a deeper level. The ethical principles of yoga, known as the yamas and niyamas, also guide my teaching. These include values like non-harming, ahimsa, truthfulness, satya, and contentment, santosha. I encourage clients to bring these values into their practice, not only by treating their bodies with kindness and respect but also by cultivating patience and acceptance toward themselves and others. For example, when a client is frustrated by their limitations or progress, I remind them of the importance of practicing ahimsa, gentleness toward oneself, and finding contentment in the process, rather than in the result. Finally, I view yoga as a path toward unity and connection, not only within ourselves but also with others and the world around us. This belief is woven into my approach by creating a supportive, inclusive environment where clients feel safe and seen. I aim to foster a sense of community and belonging, where each person can explore their practice free from judgment and comparison. In this way, yoga becomes a shared journey of healing and growth, where we are all connected by our common pursuit of well-being and inner peace. In summary, my philosophy of yoga is holistic, compassionate, and inclusive. It centers on the belief that yoga is a tool for self-awareness, healing, and transformation that is accessible to everyone. By integrating principles such as balance, mindfulness, breath awareness, and self-study into my teaching, I guide clients to not only improve their physical health but also cultivate inner strength, emotional resilience, and a deeper connection to themselves and the world around them.
What are your strengths and weaknesses as a yoga therapist?
As a yoga therapist, I believe my strengths lie in my ability to offer personalized, compassionate care, my deep understanding of the therapeutic applications of yoga, and my dedication to continuous learning. However, like everyone, I have areas where I am continually working to grow and improve. One of my primary strengths is my ability to deeply connect with clients and create a safe, non-judgmental space for healing. I genuinely care about each person's well-being and take the time to listen to their needs, challenges, and goals. My empathetic nature allows me to build trust with clients, which is crucial in any therapeutic relationship, particularly when dealing with sensitive physical or emotional issues. I prioritize understanding the whole person, not just their symptoms, and this holistic approach helps me design individualized sessions that address the mind, body, and spirit in a meaningful way. Another strength is my strong foundation in both traditional yoga principles and modern therapeutic applications. I have received extensive training in anatomy, physiology, and psychology, which allows me to safely and effectively tailor yoga practices for individuals with a wide range of health conditions, from musculoskeletal issues to mental health challenges like anxiety and trauma. My experience working with diverse populations has also sharpened my adaptability, enabling me to modify techniques or approaches to suit the unique needs of each client, ensuring that they feel supported and empowered throughout their healing process. My focus on breath work and mindfulness is another asset. I incorporate pranayama and meditation into nearly every session, helping clients develop tools to manage stress, anxiety, and emotional imbalances. This holistic approach allows me to address both the physical and mental aspects of healing, offering clients a comprehensive toolkit for well-being. I also value education, so I strive to empower clients by teaching them practices they can incorporate into their daily lives, fostering independence in their healing journey. In terms of weaknesses, one area where I am continually working to improve is managing my own expectations, particularly when it comes to client progress. Because I am so invested in my clients' well-being, I sometimes feel frustrated when progress is slower than expected, or when setbacks occur. I understand that healing is not a linear process, and everyone progresses at their own pace, but I sometimes have to remind myself to remain patient and allow the process to unfold naturally. I've learned to temper my expectations and focus on celebrating small victories with my clients, but it is still an area where I strive for more balance. Another area where I aim to improve is maintaining strict boundaries between my personal energy and my clients' emotional experiences. Given my empathetic nature, it can be challenging not to absorb the emotional weight of my clients' struggles, particularly when they are dealing with trauma or chronic pain. While empathy is a strength, I am continually learning how to create healthy boundaries so that I can remain fully present and effective without experiencing emotional burnout. Practicing self-care, engaging in supervision, and participating in regular mindfulness practices have helped me in this area, but it is an ongoing process. Lastly, while I have a strong foundation in many therapeutic areas, I recognize that there are always opportunities to expand my knowledge. I strive to continuously update my skills by attending workshops, training sessions, and seminars on emerging research in yoga therapy, especially in areas like mental health, trauma recovery, and neuroplasticity. Staying current in these fields not only enhances my practice but also ensures that I can offer the most effective and evidence-based techniques to my clients. In summary, my strengths as a yoga therapist lie in my ability to connect deeply with clients, my comprehensive knowledge of yoga's therapeutic applications, and my focus on holistic well-being. My weaknesses revolve around managing expectations and maintaining emotional boundaries, both of which I continually work to improve through self-awareness and professional growth.
How do you maintain your own yoga practice and professional development?
Maintaining my own yoga practice and professional development is essential for my growth both as an individual and as a yoga therapist. I view it as a commitment to self-care, continuous learning, and staying grounded in the principles of yoga. By balancing personal practice with ongoing education, I ensure that I can show up fully for my clients while keeping myself inspired, informed, and adaptable. First and foremost, I maintain a consistent personal yoga practice. For me, this is a non-negotiable part of my day, serving as the foundation for my physical, emotional, and mental well-being. My personal practice is fluid and adaptive, reflecting where I am at any given moment. Some days, it is more dynamic and physically challenging, focusing on vinyasa or ashtanga sequences to build strength and energy. On other days, particularly when I need rest or restoration, I turn to slower practices like yin yoga or restorative yoga. Breath work, pranayama, and meditation are always central components, helping me to remain centered, calm, and focused. Beyond the physical practice, I integrate yoga philosophy into my daily life. I reflect on concepts such as mindfulness, non-attachment, and compassion, and try to apply them not just on the mat but in my interactions, decisions, and self-care routines. The yogic principle of svadhyaya, or self-study, guides me to continuously check in with myself, both physically and emotionally, and adapt my practice as needed. By cultivating mindfulness, I am able to manage stress, avoid burnout, and maintain emotional balance, which is crucial for my work as a therapist. In terms of professional development, I am dedicated to continuous learning. The field of yoga therapy is always evolving, and I prioritize staying up to date with the latest research and developments in both yoga and related disciplines like anatomy, physiology, and mental health. I regularly attend workshops, seminars, and advanced training sessions that focus on specialized areas such as trauma-sensitive yoga, yoga for chronic pain, or the role of neuroplasticity in healing. These opportunities allow me to deepen my expertise and expand the range of therapeutic tools I can offer to my clients. I also engage in professional supervision and peer support. This helps me reflect on my work with clients, gain new insights, and stay accountable to my own growth as a therapist. Supervision sessions allow me to discuss challenging cases or situations in a confidential and supportive environment, ensuring that I continue to learn from every experience. Peer groups and networks are valuable not only for feedback and new perspectives but also for cultivating a sense of community among fellow practitioners. This connection helps me feel supported and inspired, knowing that I'm not working in isolation. Additionally, I maintain a habit of self-study through reading and research. I regularly read books, articles, and academic studies related to yoga, mental health, and holistic healing. I find that immersing myself in diverse perspectives, whether from ancient yoga texts or contemporary research on neuroscience, keeps my practice intellectually stimulating and allows me to integrate evidence-based practices into my sessions. To maintain a healthy balance between professional growth and personal well-being, I practice what I teach: mindfulness, boundaries, and self-compassion. I set clear limits on how much I work and make sure to schedule time for rest, recreation, and personal reflection. By managing my own energy wisely, I ensure that I can continue to serve my clients without feeling depleted or overwhelmed. In summary, I maintain my yoga practice and professional development through a balanced approach of personal practice, continuous education, peer support, and self-reflection. My commitment to ongoing learning and self-care allows me to stay grounded, present, and effective as a yoga therapist, ensuring that I bring the best of myself to every session.
How do you incorporate therapeutic adjustments and modifications into your sessions?
Incorporating therapeutic adjustments and modifications is a key element of my yoga therapy sessions. I approach each session with the understanding that every individual has unique needs, abilities, and limitations, and I tailor the practice accordingly to ensure safety, comfort, and effectiveness. My goal is to create a supportive environment where clients feel empowered, regardless of their physical or emotional conditions, and where the practice truly serves their individual journey toward healing. To begin with, I assess the client's condition thoroughly during the initial intake session. This includes gathering information about their physical health, any injuries or chronic conditions, and their goals for therapy. I also observe their body's range of motion, alignment, and breath patterns. This assessment helps me design a personalized plan that includes therapeutic adjustments and modifications right from the start. These adjustments are not about pushing the client to perform standard poses, but rather about adapting the practice to suit their current state, facilitating healing and preventing discomfort or injury. When it comes to physical modifications, I focus on adapting postures, asanas, to align with the client's abilities. For example, if a client has a back injury or limited flexibility, I might modify poses by using props like blocks, straps, bolsters, or blankets. Props can provide support, enhance stability, or reduce strain on certain areas of the body. If a client struggles with balance, I might encourage the use of a wall or chair to help them feel more secure while practicing standing poses. By offering these options, I ensure that clients can experience the benefits of the poses without feeling restricted or overexerted. In addition to props, I may adjust the intensity or range of motion of a posture. For clients with limited mobility or pain, I often recommend gentler variations of poses. For example, instead of a full forward fold, Uttanasana, I might guide the client into a seated version, allowing them to maintain a comfortable stretch without placing undue pressure on the spine or hamstrings. Similarly, for clients recovering from injury, I focus on movements that are rehabilitative, incorporating gentle stretching and strengthening exercises that promote healing without aggravating the issue. My aim is always to meet clients where they are, helping them build confidence and progress gradually. Breath work, pranayama, is another area where therapeutic adjustments are crucial. Many clients come to yoga therapy with stress, anxiety, or respiratory challenges, and modifying breath techniques is essential to meet their needs. For clients who may find certain pranayama practices too stimulating or difficult, I introduce gentler breathing exercises, such as diaphragmatic breathing, or guide them to slow down their breathing to reduce stress. In cases where clients experience breath-related conditions, such as asthma or panic attacks, I provide alternatives that encourage calmness and relaxation without overwhelming them. I also make therapeutic adjustments based on emotional or psychological factors. For example, if a client is dealing with trauma or heightened anxiety, I am particularly mindful of creating a safe, non-invasive environment. Trauma-sensitive yoga approaches, for instance, involve avoiding hands-on adjustments unless specifically requested by the client, and I always ensure that modifications respect their boundaries. I provide verbal cues that encourage the client to move in a way that feels right for them, rather than following rigid instructions. This allows them to regain a sense of agency over their body and experience the practice as a form of empowerment rather than another source of stress. Throughout the session, I remain observant and responsive to the client's feedback, both verbal and nonverbal. I encourage open communication, regularly asking how they feel in certain poses or if any discomfort arises. Based on their feedback, I adjust the postures or techniques in real time. If something doesn't feel right, I offer alternative options. For instance, if a client finds that a certain pose is causing strain in a joint, I might switch to a more restorative posture that achieves similar therapeutic benefits without pain. This flexibility ensures that the practice remains client-centered and adaptive to their evolving needs. Lastly, I incorporate progressive adjustments over time as the client's condition improves. As clients gain strength, flexibility, or emotional balance, I gradually modify the practice to challenge them appropriately while remaining mindful of their safety. For example, someone recovering from surgery might start with very gentle, supportive movements, and as their range of motion and confidence increase, I might introduce more dynamic or flowing sequences. This progressive approach helps clients build resilience while ensuring that they do not push themselves beyond their current limits. In summary, therapeutic adjustments and modifications are an integral part of my yoga therapy practice. I tailor each session to the client's unique physical and emotional needs, using props, gentle variations, breathwork adaptations, and a trauma-sensitive approach to ensure safety and comfort. By maintaining an open dialogue and observing my clients closely, I continuously adjust the practice to meet them where they are, fostering an environment of healing, growth, and empowerment.
How do you address ethical considerations in yoga therapy?
Addressing ethical considerations in yoga therapy is central to my practice and is guided by principles of respect, integrity, and professionalism. Since yoga therapy involves working closely with individuals on their physical, mental, and emotional well-being, maintaining high ethical standards is crucial for creating a safe, supportive, and trusting environment. I take these ethical responsibilities seriously and integrate them into every aspect of my work. One of the most important ethical considerations in yoga therapy is client autonomy and informed consent. From the very beginning of my relationship with clients, I make it clear that their comfort, safety, and well-being are my top priorities. I explain the purpose of each practice, posture, or technique I introduce, ensuring they fully understand what to expect and why we are doing it. I actively encourage questions, concerns, and feedback. In cases where physical adjustments might be helpful, I always ask for explicit permission before offering hands-on support, and I respect their choice if they prefer not to be touched. This helps foster a sense of autonomy, where the client feels empowered to make decisions about their own body and practice. Another key ethical consideration is confidentiality. As a yoga therapist, I often deal with sensitive and personal information about my clients, including their physical health, emotional well-being, and sometimes their personal histories. I follow strict confidentiality guidelines, ensuring that all client information is kept private and secure. This includes not discussing their conditions, progress, or any other details outside the therapy space without their consent. By upholding confidentiality, I create a trusting environment where clients feel safe to share their experiences without fear of judgment or exposure. Respecting client boundaries is also a fundamental aspect of my ethical approach. In yoga therapy, clients may come with a variety of physical, emotional, or psychological vulnerabilities. It's essential that I remain sensitive to their boundaries, both physical and emotional. For instance, clients dealing with trauma may have specific triggers, and it's my responsibility to provide a trauma-informed approach, ensuring that they feel in control at all times. I never push clients beyond what they feel comfortable with, whether that's in terms of physical postures, breathing techniques, or emotional exploration. The client's comfort and trust in the process are paramount, and I continuously adapt the practice to honor their needs and limitations. In addition, professional boundaries are equally important. Maintaining a clear boundary between the therapist-client relationship is essential to ensuring a safe and professional therapeutic space. This includes avoiding dual relationships, such as becoming friends or engaging in social activities with clients outside of therapy, which can blur the lines and impact the therapeutic dynamic. As a yoga therapist, I aim to provide compassionate support while maintaining the professional integrity needed for effective therapy. I ensure that my personal life and professional role remain distinct to uphold the therapeutic relationship's objectivity and professionalism. Another ethical issue is cultural sensitivity and respect for yoga's roots. Yoga has a rich cultural and spiritual history that originates in ancient India, and as a yoga therapist, I am mindful of honoring this tradition while adapting it for therapeutic purposes. I take care to teach yoga in a way that respects its origins, avoiding cultural appropriation or misrepresentation. I also ensure that my teaching is inclusive and accessible to individuals from diverse cultural, religious, or spiritual backgrounds. By doing so, I respect both the practice itself and the diversity of the clients I serve, ensuring that they feel welcomed and valued regardless of their background. Non-judgment and compassion are other key ethical principles that guide my practice. I approach every client with empathy and without judgment, understanding that each person's journey is unique. Whether they are working through physical limitations, mental health challenges, or emotional difficulties, I provide a space where they can explore their practice without fear of being judged for their abilities or experiences. This non-judgmental attitude fosters an atmosphere of acceptance, which is vital for healing and personal growth. Finally, continuing education and competence are ethical responsibilities I uphold to ensure that I provide the highest quality care. Yoga therapy is a dynamic and evolving field, and I am committed to staying informed about the latest research, techniques, and best practices. By regularly attending workshops, completing advanced training, and engaging in self-reflection, I ensure that my skills are up to date and that I am providing evidence-based, effective care. This commitment to professional development also means that if I encounter a client with a condition or need that is beyond my expertise, I will refer them to a specialist or collaborate with other healthcare professionals to ensure they receive the appropriate care. In conclusion, ethical considerations in yoga therapy are fundamental to creating a safe, supportive, and respectful environment. By prioritizing client autonomy, confidentiality, respect for boundaries, cultural sensitivity, and professional competence, I am able to offer yoga therapy that is both effective and ethically sound. My approach is grounded in compassion, non-judgment, and ongoing professional growth, ensuring that I maintain the highest standards of care for every individual I work with.